Welcome back to AM Buffalo. Well, more than 5 million teeth, if you can believe it, are knocked out every year. But only 9% of adults in the U.S. know what to do if that happens. Following the right steps can help save the tooth and your smile. So joining us this morning to talk about saving our teeth is Dr. Zweig. He's, of course, a dentist. Thank you so much for being with us, Dr. Zweig.
Thank you.
All right, so let's talk off the top. Before we get to saving your teeth, let's talk about oral health. This is super important to your overall health as well, correct?
Absolutely. We know that maintaining your oral health can have a strong effect on your overall health, and it happens on different levels. The first is that we know that when people meet you, see you, the first thing they see are your teeth, and they can judge your appearance. So this can affect social interactions. It could also affect your job. Secondly, we know that when you have poor oral health and broken teeth, that it makes it difficult to eat food, and this can affect your nutrition. So that also affects your overall health. And then lastly, we're finding a lot of potential relationships between your oral health and oral disease to systemic disease such as diabetes, heart disease, and even oral cancer. So all these things add up to say that it is very, very important to maintain your oral health.
All right, so here's the thing. What if you already get to the point where you're being told that you need a root canal or a tooth extraction? What do you need to do to make sure that you are doing exactly what needs to be done?
So the first thing to realize is that a root canal is a procedure to save your tooth, and this is opposed to extracting your tooth, which is the complete removal of your tooth. And we at the American Association of Endodontists feel that it's always preferable to save your tooth if you can. So the first question that you have to ask your dentist or the person telling you that you need an extraction is, are there any alternatives to the extraction and saving my tooth? Often root canal treatment, which is performed by dentists, but more specifically performed by endodontists who are specialists in doing root canal, can save your tooth. So you have to have that discussion with your dentist. If you do need a root canal, we're going to suggest that you see an endodontist because we do have advanced training and expertise in performing root canals.
All right, so here's the thing. We talked a lot about preventing tooth decay and, overall oral health, making sure that it's good. But what should you do if something catastrophic happens, if you are injured and your tooth is knocked out?
Sure. We're seeing this happen more and more, mainly due to accidents, bicycle, scooter, and sports accidents. The first thing you need to realize is that time is of the essence, and getting the tooth back in your mouth as soon as possible will give you the greater chance to actually save your tooth. You have to find the tooth. Often these things, you have to pick it up very carefully from the crown of the tooth, avoiding touching the root. You have to make sure the tooth is clean by washing it, rinse gently with water or milk. And then you have to put the tooth back in your mouth as soon as possible and as fast as possible. And then you need to visit your dentist to make sure that the tooth is positioned properly and the tooth is stabilized. Very often, these teeth end up needing root canal, and so a referral or to an endodontist is important. And you can actually refer yourself to an endodontist if you have one of these traumatic accidents.
All right, really important information, especially if you're into those winter sports or sports year-round. Thank you so much, Dr. Zweig, for being on AM Buffalo. If you'd like more information from the American Association of Endodontists, make sure you head over to findmyendodontist.com. It's a mouthful, literally. After the break, a beautiful